use no matter what naloxone you are using. So I want to share these with you because they are available. And if we want any consistency across the board, just let me know how you want to order these. I could send them monthly, but let's go through some of them. The first one I'm going to show you in the bottom corner, which is actually, that's our Narcan. However, the most popular item that we do have as a resource is the demonstration trainer device. And those are available to you as all of our resources at no cost. So please, no one start purchasing them on Amazon, LinkedIn, anywhere else. They're charging like $4 for $28. So we do have these for your disposal. So the poster that I'm showing you, this is it goes down to, excuse me, I'm trying to get rid of the little admit thing. It goes down to a second grade level when our product went OTC. And it's very simple to follow from the visuals and the directions. Lay, spray, and stay. So we have this in English and Spanish, and it does come in poster size for both, and also in 8x11s. This has been very popular throughout the other states I cover, throughout schools, libraries, jails. It is just a great, bright model to remind someone what to do in case of an emergency, no matter, where they are. This one I love because this is great as an education piece also. So an opioid emergency can happen anywhere, anytime. And what I love about these tear sheets, this is about a 5x7 size, is it goes through recognizing the signs and symptoms of an opioid overdose. Our facts about Narcan. So this is our drug fact label on the right. So this is on every OTC box and on the public interest boxes that you would be receiving from CDPHE. And we have this in English and Spanish. So not only are they in English and Spanish at the 8x11 size, but they also are available in pocket size guides for you to hand out to anybody that will be receiving Narcan, whether reentry, MAT services, clients, available in both languages and both sizes. That's an example of it blown up. That is the pocket guide with the visuals and the directions. So our Narcan here, it shows it's 5x4. We have these in stickers, but we also have them in window clings. They've been used on cars, at convenience stores, on windows for public entities, anywhere someone is entering to know that, if there's an emergency, it's close by. And this is actually new news. This is not one of our resources. This is new news regarding the Narcan, that the shelf life did extend to 4 years, and that those cartons will become available sometimes in Q2 this year. In Colorado, as most of you probably know, the legislation is putting forward for 20 years past expiration to be able to use naloxone products. So this will not affect everybody. This will be for certain entities like hospitals that have different reporting requirements, whether national, federal requirements, but the shelf life is extended and nothing about the product has changed. It's based on 8 years of safe and effective community use that we were able to submit and get this approved. I just wanted to attach my information. Anybody could reach out to me by email or phone number. I usually FedEx anything you need to you. Think about the resources. I will send out and make sure that Kelly can forward it out to you guys. Icons for everything that we have and everything that I shared. And again, I will let you know that it seems like the most common items used would be the demonstration trainers, the posters, and of course, the stickers. So anything you need, just please know that I'm here to support you regardless what naloxone product you're using. And I'm usually in the state every other month. I work, very close, as Kelly mentioned before, with the consortium, with CDPHE. with the AG's office. If I might have met some of you guys at the Sheriff's Winter Conferences or through the Association of Sheriffs, but I am always a phone call away, and any resources I can share with you to make your job easier and less money that the state and you all have to spend on these resources is the reason I'm here for you. So that is it for my portion of the presentation.
Hello, this is Janelle. Laura, also, by the way, I'm like, are those stickers free?
Yes, everything is free. Yes.
I just need permission to share my screen.
Okay, you should have it.
Okay.
I mean,
Perfect. Yep.
okay, cool.
Okay, just a second here. Got way too many things pulled up. Are you guys seeing like my presenter view? Yeah.
I don't know if this is the presenter view.
Oh, it should just be the slide.
Oh, okay, yeah, that's what we're seeing.
Yeah, perfect. Okay. So, again, thank you for the introduction and for letting me come speak to you all. My name's Janelle Jones. I work at the Arizona Supreme Court with the Administrative Office of the court. My division is the Adult Probation Services Division, and I'm a treatment program specialist. So, mouthful.
Janelle, I'm sorry to interrupt you. We do still have all the icons for all your pages on the left.
Oh,
so
you do?
It's not full screen. Yep. Mm-hmm.
Oh, okay. Sorry. I wanted it to be full screen so you guys could see the
Can you hit that button up in the top right-hand corner, the square?
oh, not that one. This one here?
Above that. And then to the left. That's bigger. I mean, we can see
That's
it.
definitely better. Mm-hmm.
Yeah.
I just didn't want to don't use presenter view. This should work. Well, maybe not.
It looks great.
Okay. Thank you. So sorry it's not a little bit bigger. I can also send it out. They're mostly just photos. So what I wanted to talk to you all about today are some of the initiatives around reentry that we are doing in Arizona and what we have been doing since I want to say 2018. And the major part of that is our reentry simulation. And so this is not something that we created. It was something that was taught to us by federal probation. And these are events that we coordinate all over Arizona and in other states as well, to basically put professionals in the shoes of someone who's being recently released from incarceration. So the activity that we do that was taught to us, we have formed it to suit Arizona and what like the treatment landscape looks like here, as well as like what resources are available to people here. So it's tailored to us. Well, we have taught it to people in other states and they tailor theirs to their state. So today I'm just going to be telling you about the simulations and what takes place during those, and then what the benefits are of these simulations, and kind of some results that we've seen since doing them. So some agencies that we have taught the simulation to and provided materials to are the Arizona Department of Corrections, Rehabilitation, and Reentry. So since that is such a large system, we do often do simulations for them still, but they have developed the curriculum to suit the prison system so that they're able to conduct their own. Because it's so large, it'd be difficult for us to hit all of their staff. We have done this for all of the wardens in the state of Arizona, which was a quite interesting simulation, having them run around and act like they were just getting out of incarceration. We've also helped DCS, Department of Child Safety, develop their own formulation of this, as well as DES. And so more further into what it is, the simulation, we don't tell people up front a whole lot about what they're about to do. They come in, whatever group we have is coming in, and they all receive a name tag with their new identity on it. And then they receive this life card, which we put the life card in like a little plastic like sleeve so that we're able to write on it as we do the simulation. And so this is what they get, and each person has like a different scenario. So if I was this person, Rayanne, I have my offense here. I don't have a high school education. I don't have any IDs to start out with. And I only have $30 on hand. So we use fake money for this and we put it in their little clear sleeve. Anything that they are leaving incarceration with, we put it in their sleeve. And essentially we say, okay, it's week 1, go get your stuff done. And so all of these boxes in week 1 are things that this person would have to do. Everything that's blacked out is not required. So they'd have to go to treatment. They have to eat that week. They have to take a drug test. They have to go to support group and GED class. And so we really try to think about every aspect or most aspects of someone getting released so that people can experience kind of what it's really like. So as we know, some people have lots of family support, most people don't. So we do have some people that get out and they have a couple $100 and they're able to easily go do things. Some of them have all of their IDs, so they can jump right in. All of these activities require an ID with the exception of AA and NA. And so when those people go to the different booths and tables where we have role players that are set up there, the role player just asks them, I need your ID and your bus ticket. And if they don't have those two things, then that person doesn't help them. And so that's kind of how we simulate the reality of the challenges that a lot of our folks face. Buses are still a primary method of transportation around our state. We do have a light rail, but oftentimes if we're in a rural community, they don't have buses, you know. So in those situations, we say that their transportation ticket represents them having two legs to walk, right? And to make it to that next place. And so it can be modified depending on who you're meeting with and who you're doing this for. And so as time goes on, it's about 10 to 15 minutes, depending on the group that we have and the size. And they'll come back to the middle and they'll come back and meet, which looks kind of like this photo. And we discuss, okay, what went well that week? What did not go well? What are you going to do next week so that you're more successful? When they go to all these different stations, they don't always control what happens. They take their drug test and they draw a card, and the card could say, okay, your test was negative, good job. They get a check mark for that. This person, let's say they went to AA and they pulled a card that said you were disruptive and you got kicked out. Then they get an X there. And so their goal is to get check marks and not X's, because when they go see their probation officer in week 2, their probation officer is going to look for check marks. And so that kind of represents them having to check in with someone. We have sometimes agencies will modify it to be parole. It's their parole officer they're checking in with. And so many times, most people spend this first week trying to get all of their IDs, because you need your social security card and your birth certificate in order to get your state ID. And you can't go to treatment or pay your rent or anything without your state ID. So that gives kind of a basis of what the simulation looks like. We go through each week and then we take a little break in between and talk about what's going well and what's not. So it is essentially like a game. We market it as a training because we have gotten feedback from all sorts of professionals that it's helped them to better understand the systems in Arizona, as well as kind of the struggles that people with justice involvement go through. We have done this training. I've been here for the last year, and we've done it for DCS, we've done it for legislators, we have done it for wardens. We do it at every probation officer academy. So every new probation officer in Arizona goes through this. And the focus is different depending on who we're presenting it to. So when we're presenting it at probation, we want them thinking about, okay, so when you're a PO, how are you going to help these people navigate these systems? Because you want them to be successful and they want to be successful. You have the same goals. So like, what can you do to push those things forward and help with the rehabilitative side of your job? So these are just some pictures from simulations. This is one we did in Flagstaff. I want to say in November or October of last year. This one was really unique and interesting because we had a wide variety of folks attend. It was put on by Health and Human Services in Coconino County, and their Health and Human Services department has a reentry program that is stationed inside of their jail. So we really did this one to bring in the leaders of Health and Human Services, along with the leaders at the jail, along with the lead prosecutors, public defenders, judges, essentially all the leaders in the justice system in that county were there at that training. And so when we have such a diverse group like that, it's really cool because these folks work together a lot, but they don't often get together and kind of brainstorm solutions and talk more about how they can improve their programs. So this one was a really neat one because we had that variety of people, and the discussions that we have in between the weeks are really meaningful. You know, we're able to identify, oh, well, our treatment provider is, 3 miles away and there's no bus that goes that way. So how can we better help people make sure they're making it to treatment? Service providers can learn more about the gaps in their community. Whereas when we're talking jail staff, we're more so talking about, okay, is there anything we can do within our role? There's lots of things we can't change, right? But what can we change in our role to ensure that we're making things easier for folks when they get out to be successful? Because these people are our neighbors, they are our family sometimes. And in order for us to have a more successful and thriving society, they need to be successful too. And so this activity really just gives a different perspective that most of us are not used to seeing. A little bit about some things that we've seen happen at these. I've been to simulations where we've had judges participate, and we have had judges sit down in this middle area while the week is still going on. And I'll go up to them and I'm like, Judge, what's going on? Like, why are you sitting down? We're still going. And they're like, I quit. This is too stressful. I quit. And I'm like, well, you can't quit. That would mean you go back to jail, And, these are people in positions of power. They're highly educated people. They have lots of good coping skills, and they struggle with this game, So it kind of just shows that sometimes we need to take a step back and put ourselves in the shoes of the individuals that we work with so that we can better understand them. This photo here is of that Coconino simulation. We really capitalized on having all of those leaders in one room. And after the simulation, we conducted a lived experience panel. So we have the Pathways to Community, the reentry program manager here, along with our recovery court coordinator who's in recovery in Coconino County, kind of do a panel interview with 3 individuals who have experience in the system. The 3 that we had up there have done significant sentences in the Department of Corrections, and they are all extremely successful today. So just reminding people that we can make like a great difference. We don't always see the successes with the people who have come through, but it's possible for them to be successful. And we had them share about what worked for them and what helped, and maybe what didn't help and what could have been done differently. So in this next slide, we have just some outcomes of these simulations. So the main one that I probably am most excited about is the revision of our conditions of supervised probation. So after doing this for a couple of years, our director here at Adult Probation Services, which keeping in mind that in Arizona, our probation departments are split up by county. So we have 15 different probation departments. And here at the state level, we're kind of like seen as the governing authority. at the AOC, the Administrative Office of the Court. And so we're over all 15 of those adult probation departments. And so when our leadership learned more about this, and they went through it and they started doing it more, we were able to see that there are things we're doing in probation that really probably are kind of a waste of time. One of the big ones that we found we needed to remove is the condition around not allowing people to communicate with someone with a criminal record. We realized doing these that, when we ask people, what helped you? What helped you be successful? They said oftentimes like, oh, my friend, their coworker gave them 10 bus tickets and that really helped them. So just the fact that just because someone has a record doesn't mean that they can't kind of have a positive impact on our people. So we took out that condition altogether. It's more now between the probation officer and the person on probation to determine if that's a positive individual to spend time with. Another huge one that we changed is the condition around drug use. So in the past, the Arizona conditions stated, I will not use or possess any illegal substances. And I'll submit negative drug tests, something like that. It's been a while since I was a PO. So that's what it used to say. Through doing this and through seeing all the challenges that our people have, we were able to see that a lot of folks, and have these deeper discussions, that a lot of our folks were going back to prison, revoked, their probation revoked and getting sent back for technical violations. And so they weren't committing new crimes. They weren't having like any major violations. They were struggling with their substance use. And as time has gone on and we have learned more about evidence-based practice, we realize that we probably shouldn't be sending people back to prison for their substance use alone. Or even combined with other things. If they're committing new crimes and more serious issues are occurring, that's another story. But essentially, if it's just that they're continuing to struggle with their use, at least on the probation side, we decided we wanted to do something about that. So our uniform conditions no longer say that the person will not use drugs. They say I will attend and participate in recommended treatment, and I will submit to drug tests as required. That allows us to really make improvements in that area, to better kind of work on case management with people and communicate better with their treatment and look at other alternative options other than prison. When someone is just continuing to use drugs, we need to look at other interventions, other medications. We have things available to help them. And so now it's fairly new. We're still implementing that. But we're hoping that in the future, no one gets sent back to prison from probation for continuing to use drugs because they're struggling with their use and they haven't found a solution yet. So that's one of the ways that we really have made changes as a result of these simulations. We've also made some minor changes to our code, our judicial code, as a result of these conversations. And then our state Medicaid agency, it's called Access. After doing these for several years, we realized, and all these different systems really realized, that one of the barriers is people getting from place to place to place, and they don't have the time or the ability to do all that in a short period of time. And so now we have TIP clinics. It's a targeted investment program, and these are partnerships between a justice agency and a behavioral health agency. And we call them one-stop shops over here. It's so that they can get their needs met in one place. For example, our Yuma County Adult Probation Department is in a 2-story building. Probation's on the top, and there's a health clinic on the bottom. People can come in and see their PO, and then if they need a substance use assessment, or they need to talk to someone about a change in medication, and they have, our state insurance, they can be sent downstairs and they can take care of those needs downstairs with a health provider. And so those changes have largely come about because of simulations like this. I also just have increased compassion, decreased stigma. In that Coconino County event, we had some of the lead folks with the prosecutor's office in there, and we've already seen changes, creations of diversion programs. We've seen them work more closely with people who use drugs to address that issue, rather than just giving them pleas that send them straight to prison and don't address their problem. And then when we do these events with a wide array of individuals in a certain community, that community can identify what they're missing, what's going well, and what they're missing in order to appropriately serve these people. It's also led to increased collaboration. It kind of helps to get everybody on the same page with their goals and stuff like that. This has also helped lead to conversations that have gotten us to a place where most of our jails in Arizona have a reentry program embedded within the jail, whether it be, just outside of the actual portion of the facility that is, completely secure, or inside of it. We have a bit of both across the state. But our county jails are not governed by the state. So it is a really big deal that as a state, we've been able to increase buy-in amongst different counties to focus on reentry and focus on reducing recidivism and all of those things. So that's kind of all I have on the simulation. Oh, there's one more thing that I wanted to discuss. Sorry. I could go on forever and ever about it. One of the other things that we have kind of implemented as a result of having important decision makers at the table at these events is we were seeing judges order like 6-month treatment program on the conditions of probation and stuff like that. And as we know, as professionals, it's probably not suitable for a judge to be ordering someone a length of time in treatment because they're not a treatment professional. And so having the judges at these events helps them to see what's happening at these treatment stations, and they get more insight into, oh, there's a lot more to it than, you know, this person just won't stop using. I think they should go for 6 months, you know. So it helped our judges to better understand their role and how they can more appropriately sentence people and give them conditions that are going to be beneficial to that individual. Namely, allowing the person to have that assessment done by a treatment professional. Because it was just creating a lot of extra work when our probation officers would have that person assessed, and the professional would say, that person can't do, you know, that much time in treatment. Like, their insurance won't cover it. They're not appropriate for it. And so then the PO would go back and they'd have to file a petition with the court to change the conditions. Things like this just allow us to find solutions for things that normally we wouldn't think about when we're not all coming together. So yeah, I just wanted to share that as another success with all of you, and see if you have any questions about the simulation or any of the other things that I've talked about.
Thanks, Jill. I apologize. This is Becky. Ellie had to hop off, so that left me to kind of run things. So sorry to everybody about that. But I don't see any questions asked. Does anybody have any questions for either of our presenters today?
I just wanted to also mention that if any of you do determine that the simulation is something that you're interested in, if you're ever in Arizona, please let us know, because we will plan one. But also, we do often travel to different states and conduct these if it's beneficial. So yeah, just keep that in mind. We're also talking about soon. So I'm not quite sure how my boss swung this one, but we're supposed to be doing a simulation for the members of Congress of not state Congress, but federally. We're supposed to be doing it for the senators in DC. So this is, as I said, it's a really big deal. It's something that's easily implementable. And yeah, I hope you guys gained something from hearing about it.
Awesome, Janelle. I really appreciate your time. Appreciate your information. If you could pop your contact information in the chat, and folks can reach out to you. And then if anybody has any questions or would like to connect with either of our presenters, contact Kelly or myself, and we can go ahead and directly connect you guys as well.
Awesome, thank you.
Awesome, cool. Well, thank you both again for your time. I'm gonna go ahead, and because I can't talk and because our presenters are done, I think we're good to go ahead and give you guys 10 minutes back of your time. So thank you everybody for being here. Thank you to our presenters. And we have our next meeting, I believe, is a learning community meeting. I'm not going to say the date because I don't have it in front of me right now, but it will be in mid-March. If you're curious about a date, go ahead and email me, but I will be getting an invite out for that here within the next week or so. So thank you everybody, and thanks for putting up with my voice. So I appreciate you.
Thank you.
Thanks.
Bye-bye,
Bye-bye.
everybody.